The Apley Back Scratch Test is a functional assessment that is used to evaluate the range of motion and flexibility of the glenohumeral joint. It targets the rotator cuff muscles like the supraspinatus, subscapularis, infraspinatus, and the teres minor, the latissimus dorsi, and triceps. It helps imitate internal, external, abduction, and adduction of the shoulder. The Apley test can help identify joint mobility, muscle flexibility, and any restrictions that can affect performance or indicate injury. Starting position. Start with the client standing in an upright position, ensuring that a neutral spine is maintained. Then, have your client decide if they will touch their fingertips or closed fists. Then, using the testing arm, you'll place your arm over your head. As you bring it over your head, your shoulders should be going through shoulder flexion, abduction, and external rotation. After placing your overhead arm, the lower arm will then extend out, adduct, and internally rotate to engage the pectoralis major and latissimus dorsi. Both arms will meet to ensure that the humerus and scapula work together to reach the optimal range of motion and stability. Using a tape measure, measure the distance between the tips of the middle finger or the closed fist. If negative, there will be a gap. Positive will indicate an overlap with the finger or fist. Then repeat the movement with the arm switch to assess the range of motion and flexibility of the opposite shoulder. Assessment and analysis. During the left external rotation, there is a visible gap between the biceps and ear. This gap is due to possible tightness in the latissimus dorsi or a tight pectoralis major. It is also shown that there is a visible anterior pelvic tilt when performing the external rotation position. During the left internal rotation, there is a visible scapular winging. This could be due to having a weak serratus anterior and a tight pectoralis major. Also, it is visible that there is a posterior pelvic tilt. During the right external rotation, there is a visible gap between my ears and biceps, which could be due to tightness in the latissimus dorsi and triceps. It could also mean that there is tightness in the deltoids as the reach is not all the way. During the right internal rotation, there is a visible scapular winging, which could mean there is tightness in the pectoralis major. 5 corrective exercises that could be used in a warm-up for a total body resistance training day. The first exercise is wall angels. Wall angels targets the rotator cuff, deltoids, latissimus dorsi, and core stabilizer. It helps improve external rotation and abduction of the shoulder. The next exercise is scapular push-ups. Scapular push-ups targets the thoracic spine, the serratus anterior, and the rotator cuff muscles. It helps improve scapular positioning and winging. This enhances overhead and rotational range of motion. The next exercise is cat-cow with scapular and shoulder focus. This exercise targets the serratus anterior, latissimus dorsi, and trapezius. It helps with protraction and retraction. The next exercise will be thread and needle stretch dynamic. This targets the posterior deltoids and the rotator cuff muscles and lengthens the latissimus dorsi. It helps loosen tight shoulders and rotational mobility. The last exercise is the standing side bend with cross reach. This exercise helps target the latissimus dorsi, obliques, posterior deltoid, and serratus anterior. It helps with improving arm extension and reach, balance and core stability, lengthens the oblique muscles for stability, and overhead and side reaching motions.